messages that we're getting in almost every session to a certain degree is healthcare reform. And it's a unique time for our profession, it's a unique time for us as marketers. And our role is going to be changing from we always try to get quality out there. We always try and drum up numbers. However, right now, the drumming up numbers part of that message is going to fall off, and it's going to be more quality based and delivering care in a different way that, probably no two hospitals are going to be quite the same. Now, it's a bureaucracy, and I mean, we're an educated bureaucracy, but we're a bureaucracy, just like Ford, just like Dell Computers. That's what we are, and it's not a bad thing. But what we sometimes fundamentally lack, ironically, is we lack standardization. If you have one physician who does not use a care path, there's not a lot of consequences for them a lot of times. Hospitals are starting to take a closer look at those physicians saying, Doc, this is clinically sound. You can't use Lance Armstrong's artificial hip in the 95-year-old woman. You can't do it anymore. We can't afford it. That's not the clinical path. For, hopefully Mike Kokott, that's the clinical path, because I got a couple of good years on me, maybe not as good as Lance, but and so for us, that's our challenge, to be able to convey to the consumer, this is what we're doing. It's still high quality care, but it's different. I can actually see the challenges eroding. Social media is cheaper, it's quantifiable, and more people are climbing on board. One of the highest growing users of social media are folks my age. It's not the early adopter stage anymore. And so initially when we got into social media, the team at Kish Health, I think, was very innovative in getting early. They're young, they're very smart in what they do, and they know how to talk to folks that are essentially their peers because they're talking to themselves. Today, we have a much broader audience to get to. And so, to me, I actually see those challenges eroding a little bit because it's cheaper and you can quantify, you can measure. One of the things that we've done is actually OB Suites. We have immense following on Facebook. One of the marketing department folks, I'm looking off camera because they're our support system. We've done numerous women's events that have plugged women into our health system, and literally, had close to 1,000 people between our two hospitals in, a couple short days. And then that type of leg that had on it was really amazing. They had, we ended up doing videos that described their experiences of the day. And then we had viewing parties of those videos. So the videos were done on site and described some of the challenges as women that they have in healthcare. And then we compiled those videos onto a DVD, and we actually then had, in a later date, DVD viewing parties for those videos. And so in terms of getting the consumer to recognize us as a healthcare source, as a place to go, even when you're not sick, which is what we're trying to do right now, it's really a good, that's the type of thing, that's the type of buzz you want to generate. Social media is the strategy. It is. It's cheap. I know I'm being redundant. It's cheap, it's quantifiable, it's something that you can say, you know what, we sucked this person into our system in the, just for the girls program. It was one of those 1,000 people. But you know what, they're also having a baby here. And they're coming back to, have testing here. And their kids are coming back. I mean, those are the types of things that, that's exciting about today's age that wasn't available, 5 short years ago.